Hi again. Uh, my last couple of videos were related to the cancer and their diagnostic methods, newer and older. Today I'm going to touch something on older treatment that have been tried. And you got to realize that these were tried when we did not have conventional means of lasers and radiation treatment and chemotherapy, etc. So some of these were basically well thought out processes that did work to some extent, but of course did not cure anything. And it was all temporary band-aid. But again, many of the treatment even today are similar to that. I want to talk about the newer modalities of diagnosing the cancers, including PET scan, but I will probably do that during my next videos. So the first one that I'm going to start with would be many, many years ago in late 70s when people developed esophageal cancer. There was a local gastroenterologist that I remember. He started treating them with hot water. The hot water basically scalds the tumor and causes the death of the superficial cells, and sloughing of the tumor would open up the blockages. Esophageal cancer is extremely devastating as people can't swallow solids and sometimes even can't swallow liquids. When they do try to do that and it regurgitates and goes wrong way into the lung, developing cough, bronchitis, and bad pneumonias, especially since these people were compromised because of esophageal cancer. So what he did was he just put a simple tube, rubber tube, through the nose into the area of the tumor or in the esophagus and or stomach, and then poured in a boiling hot water through it, and it was pulled back through the same tube after the suction. The effect was that this hot water caused necrosis of the tumor, and that sloughing of the tumor opened up enough passage that these people could eat better. Certainly there was also some injury to the stomach, but because there was substantial blockage in the food pipe or esophagus, actual hot water that actually went in the stomach was not that much. This treatment was never publicized, never was most successful, but certainly was done. So using heat, whether it is generated by this means or other means, has been used to burn the tumors. In early 80s, I think John Hopkins invented a radiation wire. We have often seen tumors blocking a part of the lung, that is the bronchial tube, and then people would collect the secretions, would get infection, which essentially is called obstructive pneumonia. Pneumonia that has developed due to obstruction and lack of drainage of secretions. So to combat for this, of course, there was an external beam radiation, which means giving a radiation from outside. But again, there were side effects to it. So I think early part of 80s, people developed this radiation wire. So this was a wire that one could put it into it. Through a bronchoscope or an endoscope, we would appropriately position a dummy catheter in which there was a dummy wire. I should have said catheter with a dummy wire inside. Taking into account the look and the CAT scan, where exactly the tumor is, then the patient was transferred to a radiation department where actually a live radiation wire was inserted. The segment of the live wire was barely 1 or 2 centimeters, as the tumor that was obstructing the bronchus was not really bigger than that in their length. And then that particular wire stayed in the bronchus for literally 24 hours. Since the catheter was taped to the nose, and these people were put in a room where we had to put lead curtain all around them so that the patients in the next room would not be exposed to any kind of radiation. This treatment was effective, and it needed to be done in a weekly sessions for about 3 weeks. That means total of 3 treatments. The penetration, how far deep the radiation was effective, was small. But in the bronchial tube, small was better, because if it was too deep, then you would get a perforation of the bronchus. So each time we inserted the wire, we could evaluate the size of the tumor, the depth of the tumor, and make sure that the new catheter was needed to be put it in. Later on, today, for example, and even for last about maybe 10 years, newer wires have come out with a less half-life of the radiation. So now we put in the same wires, same catheters, except that we don't have to keep the wire in for 24 hours. We literally physically could put it in for 10 minutes or 15 minutes, through which the radiation are given, the tumor is burnt out, like what the scalding done with the hot water, and we could repeat that again in a week and again in a week, so total of 3 sittings. This was very effective for tumors which are in the major windpipes, like the trachea or the main bronchi, and that was successful, and even today that could be done. This is a good and effective way of treating, especially if somebody has already gotten enough radiation to the other areas of the lung, as there is a limit to how much radiation each organ can be given to without causing substantial damage. Again, because this is a intrabronchial, through the bronchus given radiation, it is tolerated much better. Please also note that since it does not affect any other organ, the side effects from these are very minimal. Certainly the infections, the bleeding, and even the perforation are possible, but at a usual observation, they do not seem to be a major issue. In again, late 80s, early 90s, people came out with laser treatment for these kind of tumors. So usually you go in under anesthesia into the bronchial tubes, and with the help of a laser probe, you literally piecemeal destroyed or necrosed or heat coagulated the tumor. Once the tumor is dead or tumor tissue is dead, you take some biopsy forceps, remove the top part, and redo the same thing till substantial airway was opened. So this is similar to what you did with the radiation wire. The good and the bad part of each treatment is there. The radiation wires are done quickly. Patient can leave literally within 2 hours of having the treatment. On the other hand, the laser treatment was needed to be done under anesthesia because patients were intubated. It literally took 60 to 90 minutes to achieve substantial destruction of the tumor and open up the passage. But the good part was you could do one session and you could do it as long as you want and hopefully open enough tumor. This could be followed by external beam radiation, that means treatment of radiation from outside. So the earlier stages of treatment of the cancer was with hot water. Next one was with a radium wire, which were from inside the bronchial tubes, which burned the tumor. It lasted about 24 hours because of the radiation given, the isotope that were used were lasting for 24 hours. And the newer ones that we do now are about 10-15 minutes only. The bad part is the penetration is small, so you need to do repeated sessions. Laser treatment is still being done, though not as commonly as it was done in early 80s. Again, one could consider combining all the modalities depending upon how much radiation was given before, what is the patient's tolerance, and many other factors come into play. The location is also very important. Certain areas are difficult, certain areas are easy. Sometimes the catheter that we have put it in can get dislodged, and that causes the problem. So again, these are some of the newer modalities of treatment which are not chemotherapies. These are radiation type of treatment or destroying the tumor. I want to go back to talking about the PET scan, which is a diagnostic modality, probably next time. Thank you for watching. Hope you like it and would subscribe to this channel. Have a nice Thanksgiving. Thank you.